So prolapse pelvis is actually a very common condition, and patients usually present with a bulge. They usually present with, I feel a bulge, I see it, or I feel something's falling down, I feel my bladder is coming down, and I maybe they may come and say, I'm going to the bathroom so much often now, and before I reach there I just leak, or I'm leaking with cough, sneeze, and laugh. Something just doesn't feel right there. And, but the most common symptom for pelvic organ prolapse is bulge, is a feeling of bulge in the vaginal area. So this is the female pelvis, and as you can see, this is a bony structure and it has muscle as a hammock. The red which you see inside this is the muscle, and it acts as a hammock and it supports the pelvic organs. The pelvic organs are the vagina, the rectum, and the bladder, and the pelvic organ prolapse is caused by weakness in the muscles and the ligaments which hold these structures together. So it can happen as a result of childbirth. When a woman gives birth, the muscles and the ligaments get stretched. It can also happen as a result of menopause. As we get older and the amount of estrogen in our body declines, these muscles and ligaments become weaker, and it predisposes a woman to have laxity in the vaginal area and predisposes her to the bulge or the prolapse. We have very good non-surgical treatment options available which actually benefit a large number of patients. So there are two of these treatment options are pelvic floor physical therapy and the use of a pessary. So pelvic floor physical therapy is an area of physical therapy which has really become very popular and very effective in the past few years. What it involves is a trained pelvic floor physical therapist who helps the patient understand their pelvic floor, that is the muscular hammock which supports these organs, and helps the patient train their individual muscles based on what the particular patient's pelvic exam is like. The second very effective option, which is again non-surgical, is the use of a pessary. So pessaries are devices which are made of silicone, and they can be inserted in the vagina, and they come in different shapes and sizes. They're very easy to insert and remove. Patients can learn how to remove and clean their own pessary and put it back in, and it helps a lot of patients. Pelvic organ prolapse is so common, like 40% of women who've had a childbirth vaginally will experience some symptoms will have a bulge, and they may or may not be symptomatic with it. So if they are not symptomatic with it, then they don't need treatment. But if they are symptomatic with it, then the conservative methods of using pessary or pelvic floor physical therapy can be very effective.